always choose the aisle seat. Why is it a good idea to always sit in an aisle seat? Have you actually given this a thought? Welcome to Clinical Charts with Dr. Williams, where we shed light on common health problems and medical conundrums. Give the video a thumbs up and subscribe for factual medical information from an internal medicine specialist. If you are a travel aficionado like me, but can't always afford to fly first class or business, choosing your seat ahead of time is of the utmost importance to optimize comfort on your trip. Beyond ease of access and more legroom, from a doctor's perspective, there are more reasons to endure being bumped by the service card or having to lean away from people walking by, or, as is many an air traveller's pet peeve, having to get up every time the passengers in the row need a bathroom break. Sitting for prolonged periods of time increases the risk of blood clots in the legs. A blood clot can form in the veins of the legs and is called a deep vein thrombosis, or DVT for short. This can obstruct the blood flow in the legs to varying degrees, but in some cases can break off and travel to the lungs, causing a pulmonary embolism, which is very serious and potentially life-threatening. It's not always about a long flight really. There are a number of risk factors which include any condition that makes your blood more sticky, like cancer, pregnancy, hormone therapy, certain genetic conditions, dehydration, smoking, and, wait for it, high altitude, where oxygen concentrations are lower. And this is because of how the body naturally reacts to lower oxygen levels. Hence, a combination of reduced mobility, being at a high altitude, and often dehydration can be a recipe for developing a blood clot, especially if you sit for more than 4 hours. My personal routine, which works like a charm, is getting up every 2 hours or after every movie, because I like to watch movies, and stretching my legs. Now, doing the foot exercises, which you can find in your safety card, every hour, and wearing flight stockings is also prudent. Many seats do not provide sufficient leg room to cross your legs, but yes, avoid crossing your legs for long periods. The cabin crew understand that you're likely to be dehydrated, and they often pass water and beverages around. Do not hesitate to take a drink when you're offered. The risk of DVTs may persist for up to 8 weeks after your trip, so report any leg pain, swelling, redness or engorged leg veins. If you develop chest pain, become short of breath, or experience unexplained dizziness, seek emergency help. Lastly, if you have had a blood clot in the past or are at risk, speak to your doctor. And oh yes, do not forget travel insurance. So, knowing what you do now, let others fight over window seats and be gracious enough to get up however often you have to. Remember, you have the advantage. What are your considerations for choosing your flight seats? Are you an aisle seat enthusiast or a scenic view seeker? I'd love to read your comments below. Thanks for watching. Remember to like the video and subscribe to the channel for more health nuggets from Clinical Charts with Dr. Williams. Bye.